talk a few about the myths and misconceptions surrounding liposuction. The first and foremost is liposuction is a weight loss procedure. Right at the outset, let me tell you that liposuction is a body contouring procedure. It is not a weight loss procedure. Yes, you do lose weight, but it is more an inch loss procedure rather than a kilogram loss procedure. So yes, your body shapes up a lot better and it tones up a lot better. It looks a lot better, even though your weight reduction might not be similar. So liposuction is a body contouring procedure. It is an inch loss procedure. It is not a weight loss procedure. So that is the first and foremost thing. Liposuction can treat cellulite. Cellulite is totally different from liposuction. Sadly, many of the women around still don't know the distinction between what is cellulite and what is lumps or fatty lumps. Cellulite is actually in the skin. Okay, it is an inflammation and it is a water collection or water retention inside the skin, and that is what causes that irregularity and the unevenness. And it also shows up, a typical example is when you look at the orange peel. If you have an orange peel kind of an appearance, then that is typical of a cellulite, because that shows up in the, because of water retention in the dermis, so it all swells up. Most commonly people think the unevenness or the fatty bulges that you have to be cellulite. So cellulite is a totally different procedure that cannot be treated with lipo, that is not treated with liposuction. But yes, uneven bulges, uneven fatty deposits, they are the ones that are treated with lipo, and that can help smoothen them out a lot. And of course, if it is more, we reduce them also, so it can work both ways. But yes, cellulite is not treated with liposuction. Another common myth is that liposuction is dangerous. You've been hearing about, off and on, these stories come up in the news that okay, there was such and such actress who had a procedure done and she died, or there was somebody else who done liposuction and they died. But what you have to realize is that the whole story doesn't come out. Okay, there are certain things that you have to be careful about, yes, and that is why you go to a trained person. You go to a plastic surgeon who is actually trained in how to do the procedure, and also on how to manage problems and manage complications. Surgeon, go to a board certified plastic surgeon and get yourself evaluated, and then do it. When done by the right people and when done by the right techniques, the complication rates are minimal. Most of the times they are all small issues which are during the healing period. So it is not dangerous to your health, it is not dangerous to your life when it's done right and when it's done with the right concept in mind. Another misconception is the fat will return, or the fat, once you do lipo in one area, the fat goes into another area. No, it doesn't happen that way. The fat doesn't migrate. Yes, if one area you have about 100 fat cells and with lipo you're removing about 70 of them, then in that area you only are left with 30 cells. Whereas in an unoperated area, for example, if you've done it in the tummy and your arms and other areas where you have not been operated on, so those areas still have 100 cells. When the fat is being distributed, it goes equally to all the cells. So if you don't look after yourself and you don't maintain a proper diet and exercise regime and follow and maintain your weight, then the fat starts depositing again. But in areas where the lipo is not done, there are 100 cells, whereas in the area where the lipo is done, there are only 30 cells. So the rate of return in that area is very less, but in the other areas, yes, you can collect more fat because the number of cells is more. That is why the people say, oh, when you do it lipo in one area, you start gaining fat. No, you still have to maintain it. It is not magic, it's a process, it's a procedure. You have to do your bit. We are doing our bit by removing the fat. You have to do your bit by maintaining what has been achieved after the lipo. So that is on you. Another misconception is lipo is only for women and celebrities. No. we do a lot of men who are undergoing lipo. We do lipo for the chest, for the abdomen, for the flanks, for the love handles. Okay, so men are equally, almost 50% of our patients are men. So lipo is not only for women. A lot of men do it, and no, again, for it is not the celebrities who are a major chunk of patients. Most of our patients, 90% of our patients, are normal day-to-day people like you and me, who go to work, come back, they have their issues. So that is why we are getting the lipo done. Sedentary lifestyles, not able to look after themselves properly. So the lipo is just helping them lose those inches. Maintenance is still on you. Maintenance is always easier. Losing is the difficult part. That is why we come in and we help you lose that. So you know, it is not only for women, and no, it's not only for celebrities. Another misconception is liposuction will help tighten the skin. Liposuction does not help lax skin. It only helps remove the fat. And yes, if it is if your skin is too loose, you have lost a lot of weight suddenly, or if your age is above 50 years, then your inherent elasticity of the skin is less. So the skin might not shrink in completely. You might still have some loose skin to deal with later on. But most of the times when you're doing a lipo, with the skin shrinkage, with the use of pressure garment, with the massages, that helps the skin shrink. It hastens the elasticity of the skin, causes it to shrink. It's just like pregnancy, the belly goes up and it comes back the same way. But yes, you have to assist it by using a pressure garment and doing your massages and moisturizing your skin so that it shrinks better. If you are above 50 and your skin quality is not good, it's too dry, a lot of stretch marks, then yes, the skin might not shrink completely. Then you might have to look at some body lift or skin tightening procedures, which is different from a lipo. Age, yes, age plays a factor in the contractibility of the skin. So how elastic your skin is and how much of the skin will contract. But apart from that, age is not an issue. As long as you're medically fit, you don't have any chronic medical illnesses which are hampering your healing, and you have an active and healthy lifestyle, you can go ahead and do a lipo at any age. And the only issue being the skin elasticity as your age is going down. So the skin may or may not shrink completely, but you might still have some shrinkage. If the shrinkage is not complete and if it's too bad, then you might have to do something for the skin laxity. You can do some skin tightening procedures, but per se lipo can be done at any age as long as you're medically fit. Doc, I have my wedding next week. I want my liposuction done. I want some magic to be done so that I can get all fit. That doesn't happen. It's a process. There is preparation time, there is a surgery, there is healing time, and then there is the recovery time. You can rush yourself, you can rush the surgeon, but you cannot rush your body. Nature will take its own time. So if you have a function, if you have a wedding, if you have something which is coming up in the next month, 3 to 4 weeks, and then you want something to be done, ideally I would suggest don't do it, because you have that healing time. Even though especially when you are going to be on camera or you're going to be shown close-ups, so I would advise that give yourself that healing time. Most patients get back to normal activities within about 3 to 4 days time, or maximum a week. But yes, complete healing takes 3 months. For the skin to shrink, for the swelling to go down, for you to feel totally normal, it takes anywhere between 3 to 4 months. But you can start your exercises, you can start your routine activities maximum within about 1 to 2 weeks, depending on your healing and the volume removed. And then you start maintaining it, wear your garment, do your massages, and then allow your skin to heal and allow your swelling to settle down. So hopefully some of the misconceptions regarding the lipo have been cleared. If you have any other queries regarding to liposuction, please drop in your comments below. We'll have a look at it and we'll try and answer them as quickly as possible. Thank you for watching.